Hello, everyone. Are you suffering from severe back pain that just won't go away? Or has your doctor recommended spinal fusion surgery? In this video, we will explain everything you need to know about spinal fusion in a simple and clear way. So watch till the end. What is spinal fusion surgery? Spinal fusion is a surgical procedure where two or more vertebrae, bones of the spine, are permanently joined together. This helps to reduce pain, stabilize the spine, improve movement. Doctors use bone grafts, screws, or rods to fuse the spine and make it strong and stable. Why is spinal fusion needed? Spinal fusion is recommended for patients with herniated disc, spinal stenosis, scoliosis, curved spine, degenerative disc disease, spine fractures or injuries, severe chronic back pain. If non-surgical treatments like medicines or physiotherapy don't work, surgery becomes the best option. Types of spinal fusion surgery. There are different types depending on the condition. Posterior fusion, done from the back. Anterior fusion, done from the front. Interbody fusion, disc is removed and replaced. Your doctor will decide the best type based on your problem. Procedure, step by step. Here's how the surgery is performed. Patient is given anesthesia. Surgeon makes a small incision. Damaged disc or bone is removed. Bone graft is placed between vertebrae. Screws/rods are used for support. Spine gradually fuses over time. Surgery usually takes 2 to 4 hours. Benefits of spinal fusion: long-term pain relief, improved posture, better spinal stability, increased mobility, improved quality of life. Recovery time. Recovery may take hospital stay 2 to 5 days, walking within few days, full recovery 3 to 6 months. Physiotherapy is very important for faster healing. Thank you for watching. If you or your loved one needs advanced, high-quality, and affordable treatment in India, MedWorld India is here to guide you at every step of your journey.